friends, welcome to another episode of Coffee with Ravi. Today we have a guest, my partner Dr. Sial. Dr. Sial is a board certified gastroenterologist. He's also certified in obesity medicine and has some special interest in looking at the pancreas among many of his other interests. So welcome Mo to this episode. Today we're going to talk about pancreatic cancer. Pancreatic cancer is a serious disease and November happens to be Pancreatic Cancer Awareness Month. So this video is dedicated to all the patients and family members that have unfortunately had to have a brush with pancreatic cancer. Pancreatic cancer is cancer that arises in a gland that sits behind the stomach. There's two parts of it. There's an endocrine part of it and there's a exocrine part of it. In other words, a part that secretes juices and a part that secretes hormones. And we're probably going to be focusing a little bit more on the part that focuses on that secretes the juices and digestive juices. That's what we are referring to as pancreatic cancer, because the other neuroendocrine cancers are a sort of a different animal. So with that caveat, welcome. And what's the most important points that we need to communicate to our patients as it relates to why it's important to have pancreatic cancer in their minds? What are the signs and symptoms? How does it present?
Thank you so much, Dr. Ravi, for inviting me to talk about this. It is a topic that is very close to me, and I'm very passionate about this. So, pancreatic cancer is a very complicated, complex, and high-risk disease, and cancers with one of the highest mortalities. Part of the reason is because of difficulty in diagnosing it at a very early stage, where there's more treatment options, and also it's just very aggressive because of the purpose and location of the pancreas. So briefly, some of the risk factors for pancreatic cancer are one of the main ones is family history. Mm-hmm. So if there is a family history of pancreatic cancer, that increases risk. There are certain genetic mutations that increase the risk for pancreatic cancer as well. Other than that, other risk factors are smoking, chronic pancreatitis, and so those are some of the other main ones.
Yeah. And when should patients, what symptoms, should they be, because that's usually the first sign, right, that something is going on. What is that something that is going on that they should become aware of? Pain, weight loss, what do you think? And these are unfortunately late symptoms, but certainly where should the awareness be on the symptom side first?
Yeah, that's a very good question, and that is what the real tricky part is, that there isn't any one specific symptom that we can focus on and say, because of this, that you have pancreatic cancer. Symptoms, and like you said, usually show up a little bit later in the stage of the pancreatic cancer. So, most commonly would be pain that is usually in the upper abdomen, what we call epigastric area.
Sort of right here. Yeah.
Exactly, and it can radiate to the back or to the left side of your abdomen. Any kind of unintentional weight loss would be a high risk. New onset diabetes mellitus, so because insulin is one of the major hormones that's produced by pancreas, and in cancer of the pancreas, that insulin is affected, hence patients can develop new onset diabetes or even worsening of their otherwise controlled diabetes. Other symptoms are jaundice, yellowness of the eyes or skin, and that is more so because of the location of the tumor that can compress the bile ducts that connect with the intestine to release the bile there.
Yep.
So those are some of the things to
those
keep
are some
an eye on.
yeah. On the family history side, Mo, is there any more granular that we can get? Is it one family member? when there's family history, is it broadly one family member, two family members? What's the latest recommendation?
Yeah, that's a good question. So with family history, the risk of any individual increases as the number of family members increase that have pancreatic cancer. So in some way you can think of that if there's one family member, there's certain risk associated with it, depending on, again, what was their underlying other mutations or things like that. But if there's two family members or three family members, that risk multiplies.
Yeah, yeah. So that piece is the thing. And then how about smoking? Smoking history, that's a big risk factor.
Absolutely, yeah. Smoking can certainly, cigarette smoking or tobacco smoking specifically has a lot of carcinogens and is associated with a lot of other cancers as well. And in a similar manner, it can lead to pancreatic cancer too.
There's been a lot of discussion. We did a post last week about visceral obesity and metabolic associated steatotic disease or fatty liver. Is that visceral fat and connection to pancreatic cancers?
I think that's a very good thought. I'm not aware of any direct correlation.
But it's more the esophageal, it's more the other cancers and not
Correct.
the pancreatic.
Yeah. Absolutely, yeah. But it could in some way, because that increases risk for diabetes,
yes.
And it does have effects on how the pancreas works and secretion. So I'm sure there might be some unknown risk associated with this.
If there is a family member that has one of these gene mutations that are associated with early pancreatic cancer, those are the groups of patients that should seek either genetic counseling help or get some help to kind of look and see if that applies to them, right?
Absolutely. So that is a little bit of the complex part, because pancreatic cancer luckily is not very common. But when it does happen, it's a more aggressive disease, right? So our current screening strategies do not include screening everyone, the general population with average risk, like we do with our colon cancers or some of the other cancers. So the screening, the way the American Society of Gastrointestinal Endoscopy, their pancreatic cancer screening team recommends is to identify the high-risk individuals based on their family history, right, and their genetic mutations, and recommend screening for these individuals.
Yeah. So how do we screen for them?
So the screening is done by imaging of the pancreas, and there's two types of imagings that are recommended for looking at the pancreas to look for early changes or tumors or cancers for screening. So one is an MRI of the pancreas, yep, specifically with the pancreatic protocol, and the other type of imaging modality is an endoscopic ultrasound, where we look at the pancreas using an endoscope, a special endoscope that has an ultrasound tip attached to it, and that ultrasound is performed from within the stomach, yep, which is right next to the pancreas. Mm-hmm. Yeah.
So, in other words, we'll insert a slide here where it shows you how this endoscopic ultrasound looks like and how the MRI looks. We do both of these at Digestive Health Center, and Dr. Sial does this. The other piece of it is, nowadays with early detection, the survival has improved to some degree. What's your sort of comment on that? The earlier the detection, the better, right?
Exactly. The goal for a lot of the screening tests is to identify the problem or tumor, pancreatic cancer in this case, at an earlier stage where it can be treated more properly. Ideally, if there is a surgical removal that can be done, or before the cancer has spread to other areas. So the more we can achieve that, then the survival definitely improves. Another thing I do want to mention is that with screening, these are recommended every 1 to 2 years.
Yeah.
So compared to like other colonoscopies, which are more, the intervals are more spread out. So that is another thing to keep in mind. Again, just because of
In the people who are
aggressive
high
nature.
risk,
That
in the
is
people who are
correct.
higher risk, not high risk, but higher risk. Yeah.
Absolutely, yeah. So, and the recommendation is to alternate between the MRI or the endoscopic ultrasound. That can be done, and both the imaging modalities are recommended types, and we can decide based on specific patients, whether they would benefit from an MRI or an endoscopic ultrasound. It depends on what their personal choice is. Are they claustrophobic? Can they get an MRI? Is there any other contraindication like metal in the body that they would not be able to get an MRI? Or an endoscopic ultrasound where we are able to look at the pancreas in even more details. So those are some of the ways to do this.
Yeah. Any other points you want to share with our patients?
Yeah, so I think the important things to remember is that it is a scary disease. That's no doubt about that. So being mindful of that, but at the same time, the screening is best utilized in patients who are at high risk. That is identified by either family history or certain genetic mutations. So we need to keep all of those things in mind and have a really good discussion with our patients, help them understand what that risk is and what the risk of screening is as well, whether it's the cost associated with it or other stresses and things like that. So those would be important things to consider.
Yeah, thank you. Well, so thank you for joining us. If you have more questions, always feel free to email us or call us. We're here to continue to serve the population here.